Hilary, I'm going to turn back to you. You are somewhat of an expert on patient communication. What are the most common communication gaps you see between patients, caregivers, and providers?
I will start at the provider side. In healthcare, there's a lack of information transfer. You can see one person, say a urologist, about bladder problems, urinary frequency, and that information, those medications, may never get communicated to, say, your primary care doctor, or maybe not even your Parkinson's disease specialist. And some of those prostate medications can really affect your blood pressure and contribute to falls. So part of the communication gap is on the provider side. Also, we have electronic medical records, which can be helpful, but it's possible, depending on where you are, that your doctors are on different electronic medical records that don't communicate with each other. So that's another big issue. And this leads to sort of fragmentation of your care, where the doctors don't necessarily know exactly what's going on in your entire situation, and you may be left confused, not sure of what to do. And then I think the other issue with communication is that there is so much information out there. And what doctors need to know is really detailed to make sure you're making the right prescriptions and everything. But patients don't need that level of detail, but they need to know what they need to know, not what's nice to know. So it's sifting through all this information. What is the key information you need that's practical, day-to-day, to manage?
Well, very great advice. And we definitely recommend that you, every time you speak to any doctor, no matter what you're speaking to that doctor about, you mention that you're on Parkinson's, you mention what medications you're on, and you make sure they understand what that means.